close. Now, tonight in Medical Rounds, hundreds will gather to celebrate something very special next weekend, Surviving Cancer. The 28th Annual Cancer Survivors Day event, sponsored by Hartford HealthCare, is a day to recognize the strength, hope, and courage of patients and their families in the fight against cancer. And joining us live now is Dr. Andrew Salner, Medical Director of the Hartford HealthCare Cancer Institute at Hartford Hospital, who has been there since the inception of this event. Good evening, Dr. Salner. Nice to see you again.
Good evening, Denise.
Well, the event, as we know, is happening on September 9th, 9:30 to 11:30 a.m. at the Marriott in downtown Hartford. Tell us about this special day. What can people expect?
Well, Denise, it's really a very special day for us because some 300 cancer patients and their family members will come downtown, not for a doctor's visit or a chemotherapy treatment or a radiation treatment, but rather for a morning filled with inspiration, humor, and hope. The patients and family members will have a chance to network with one another, but we'll also hear from many interesting speakers, including Helen Gray. And Helen and her husband have left such a wonderful legacy to our entire community. And our guest speaker this year will be Colin McEnroe, columnist and radio personality from the Hartford Current and WNPR, who will inspire us with some comments as well.
Oh, it sounds like a great event. Now, this is a big question for you that I'm not sure you can answer in a few seconds, but how has treatment changed in the past 28 years? How are we doing in the fight against cancer?
Well, we're really making major evolutionary steps towards improving the results from cancer, Denise. Some 28 years ago, when the Gray Cancer Center first opened, our 5-year survivorship from cancer was about 50%. And we treated patients with more of sort of a less organized approach in terms of giving treatments more sequentially, that is, perhaps surgery and then radiation and then chemotherapy. Now, we use a much more coordinated approach where an entire team of doctors with different specialties meet. That's the patient's multidisciplinary team. They surround the patient. They develop a personalized treatment plan before treatment even begins. And then they support the patient and family during their entire treatment course.
And the outcomes we're hearing are much better than they used to be.
Today, 65% of patients will live 5 years after cancer therapy without a recurrence, Denise. So
wow.
The results continue to get better every year.
What a positive note to end this interview on. Yeah. Thank you so much, Dr. Salner, and good luck with your event. It sounds terrific. And thank you for all the work you do for cancer patients.